Hi everyone, today I want to share my thyroid surgery experience. I'll talk about preparing for surgery, the surgery day itself, and the recovery afterward. So, if you are planning to have thyroid surgery, I hope my personal experience helps you feel more prepared and less anxious. Part 1, Preparing for surgery. Before surgery, it's really important to rest. Try to avoid going out too much, especially around people who might be sick. For me, exactly 1 week before surgery, I got a sinus infection. It caused a lot of stress. I was worried my surgery might be postponed. I went to my doctor and got treatment. Luckily, I recovered in time. Part 2, Surgery Day. Surgery day was not as scary as I thought. I arrived at the hospital in the morning. Nurses, doctors, and anesthesiologists all checked on me. They made sure I was comfortable. I felt surprisingly calm. The surgery took about 2 hours. After that, I went to the recovery room for an hour and a half. Then I was moved to my hospital room. The doctor said that if I didn't feel comfortable, I could go home the same day. But I decided to stay overnight. I'm glad I did. It was my first time having surgery, so I felt low. Even simple things like using the commode were a new experience. But after taking my pain medication and a little food, I started to feel better. Part 3, Tips for eating and swallowing after surgery. One thing I didn't know, swallowing after thyroid surgery can be painful. Even water or pills hurt. Here is a tip. Keep your upper body at a 30-degree angle while resting. So you can use any 30-degree wedge. But when you need to swallow food or water, sit up closer to 90-degree, like the normal sitting position. Tilt your head slightly forward. This makes swallowing much easier and less painful. Part 4, Showering after surgery. On the second day after surgery, I decided to take a shower. I didn't spray water directly on my throat. I washed my head and body, letting the water gently go around the neck area, my throat area. This helped clean any blood or residue. Make sure you only shower when you feel comfortable. After showering, dry the surgical area carefully. I used a pad to gently pat it dry. You can also use a hair dryer on low pressure from a safe distance. Keeping the area dry is important to prevent irritation or infection. Part 5, Recovery at home. After going home, continue using a 30-degree wedge or pillows while sleeping. It makes resting much more comfortable. I use 2 or 3 pillows to find a good position. It took about a week for me to return to my usual sleeping position. I'm a side sleeper. For pain management, I took ibuprofen 3 times a day after surgery. Gradually, I reduced it over a few days. By the fourth day, I stopped taking it completely. Today is day 8 after surgery. I feel much better. I can move my neck without pain. I still feel some numbness in the surgery area. My doctor said I can remove the stitches after 1 week, so I'm planning to get them removed in 2 days. Overall, my thyroid surgery experience went smoothly. Key points I learned: prepare your body beforehand, take care on surgery day, follow tips for swallowing and showering, elevate your head while resting, give yourself time to recover at home. I hope my experience helps anyone above to go through thyroid surgery. If you found this video helpful, please like, comment, and subscribe. Let me know if you want me to share more tips for the days following surgery. Thank you.